Myocardial infarction, MI. This is the sixth lecture. Three known causes of the damage include elevated level of cholesterol and triglyceride in the blood, first one. The second, hypertension. Cigarette smoking, the third one. And the most significant modifiable risk factor that may lead to coronary artery disease is hypertension. Gradually, as fatty substances, cholesterol, cellular wastes, products, calcium, and fibrin pass through the vessels, they are deposited in the inner lining of an artery. As a result of this deposition of these materials, a lipid plaque with a fibrous covering, also known as atheroma, this will build up inside the blood vessels, and this blood flow may become partially or completely blocked. ممكن يصير في انسداد جزئي او انسداد كامل في جريان الدم داخل الاوعيه الدمويه نتيجه تراكم كل هاي المواد اللي شرحناها سابقا. The injury to the blood vessels and the resulting accumulation of these substances in the inner lining of the artery cause white blood cell, smooth muscle cells, and platelet to aggregate at the site, so that at the site of injury and at the site of accumulation of these different type of material lipid substances والأثيروما اللي حكينا عنها تيجي الوايت بلود سيل والسموث مسل سيل والبليتلت تتجمع في مكان الانجري. As a result, a matrix of collagen and elastic fibers form and the endothelium become more thicker, so that the inside of the vessels more thickness. The core of the fibrous plaque can become necrotic and hemorrhage and calcification may result. Because of the fibrous plaque, the amount of blood flow through the artery is reduced and result in decreased blood supply and oxygen supply to the tissues, so that this plaque that is accumulated inside the artery obstruct the blood flow, so that the oxygen supply to that part will decrease. However, the symptom will not occur until the obstruction reach 75 or 70-75% or more of the blood supply to that area, which is occluded. As the cap matures, the inflammatory substances weaken the cap and cause it to rupture. الفايبرس cap هاي mature and the inflammatory substances قد تضعف هاي الكبسولة ممكن تؤدي إلى أنها تصير لها rupture انفجار. Once the cap is ruptured, the coagulation cascade is initiated and the clot is formed, which result in a complete obstruction of the blood flow in the vessels, so that the danger starts from the accumulation of fatty lipid material, accumulation of atheroma cap, then lipid plaque, then the inflammatory process weaken this plaque until its rupture. تبدأ الخطورة بتكوين البلاك. إذا الخطورة وين؟ بتكوين البلاك that may obstruct the blood flow and decrease the blood flow. The most serious thing is that plaque rupture. When that plaque rupture, the clot is formed and this may result in injury to the cardiac muscle. كمان شوي راح نعرف الأمعاء إنها damage in the cardiac tissue due to the formation of clot نتيجة تشكيل الكلوت at the site of plaque rupture. إذا المشكلة بتكوين البلاك ومنخاف أكثر إذا صار في إيش plaque rupture. نتيجة البلاك rupture رح تتكون عنا كلوت. هاي الكلوت رح تسكر جريان الدم تعمل complete obstruction وهذا يؤدي إلى complete cessation of the blood flow to part of the heart that may result in damage, injury and further necrotic tissues of the heart. This picture clarifies the process of the accumulation of atherosclerotic process inside the vessels. In the first A picture, adventitia الطبقة الخارجية الميديا الوسطى الانتيما الانر لاير والاندوثيليوم. The monocyte migration نتيجة وجود injury، نتيجة وجود inflammatory process، smooth muscle proliferation. بتيجي الفاتي ستريك بتتكون من الليبيد المواد الدهنية. ومن ثم في آخر صورة في الإي الفايبرو فاتي أثيروما collagen lipid deprived presented here. This is the clarify the component of the lipid plaque that may in the future with any stress, with any pressure, rupture and may result in clot formation and complete obstruction and cessation of blood flow. Acute coronary syndrome may be classified either into ST elevation MI and non-ST elevation MI. The acute and unstable angina. 3 نقاط. إذا إحنا بنصنف الأكيوت كورونري سندروم إما MI وإما angina. الMI تصنف إما STEMI اللي هي ST elevation MI أو non STEMI اللي هي non ST elevation MI. وإذا ما كانت MI في عنا unstable angina. إذا ذكر واحد من هالثلاثة هذول نسميها acute coronary syndrome either unstable angina non ST elevation MI اللي كانوا يسموها non Q wave MI والستيمي اللي هي ال ST elevation MI اللي كنا نسميها Q wave MI سابقا. Acute coronary syndrome, this term include unstable angina and acute MI. والacute MI قلنا ممكن تكون STEMI ST elevation and non ST elevation MI. Unstable angina refers to unexpected chest pain or discomfort that usually occur while at rest. من أهم صفاتها إنه chest pain occur at rest because there is a high percentage of the obstruction inside the coronary artery that the blood supply decreases significantly to the heart muscle and the obstruction may be more than 70% of the coronary artery. This blood supply is enough at rest in some patients, but with small little activities that the chest pain starts. Also, this blood supply with unstable angina patient become not enough even at rest. حتى في وقت الراحة مش كافي وبالتالي the chest pain start at rest.